Well, the Senate pushing back that vote on the health care bill yet again. This, of course, after Senator John McCain has announced he's recovering from that surgery that successfully removed a blood clot above his left eye. You know, the GOP's margin in the Senate is just too razor thin to hold a vote without anyone missing. That's why they're delaying it. Can they get it done? Isaac Wright joins us. He's a former executive director of Correct the Record, which was the principal pro-Clinton super PAC in 2016. And Adam Goodman, Republican campaign strategist, and Edward R. Murrow, fellow at Tufts University. Welcome both. Adam, let me start with you.
Good to be here.
Thank you. Look, they've tweaked the bill. They've got some steps. They're offering the bare bones policy. Some people could opt out. They've kept the Obamacare taxes. Does this delay, indirectly, and unfortunately for the senator, we wish him well, but in a way, does this delay help them get past the finish line?
It just may, because right now, Eric, what we've got is a healthcare system I equate to a car with bad brakes. It's barreling down the road. We know it's going to be just a matter of time before the brakes don't work. And in the back seat of that car are our children, because it's our children who are going to get it, right between the eyes in terms of the debt burden from a healthcare explosion that is out of control. We see Medicaid that's more than doubled in 8 years. We have Medicare with 77 million baby boomers coming in, having paid 1/3 in what they're going to receive in benefits, and a $20 trillion national debt. We have to get something done to control the spiraling costs. And whatever happens here, Eric, we've got to get that under control, or everything else in the American experience, frankly, is in peril.
Yeah, Isaac, how are they going to get that done? I mean, can they do it? Susan Collins of Maine. A no vote because of the Medicaid slashing her state. The rural hospitals rely on Medicaid for their funding tremendously. So, Isaac, she raised the issue that Democrats now, potentially could work with the Republicans. Do you think that will finally get a bill together? Do you think the Dems will do that?
Yes, I think they have been making those entrees for a while in the Senate. As I'm sure you both remember, it wasn't that long ago, just 2 or 3 weeks ago, that the Democratic leader in the Senate invited the Republicans to a meeting to try to talk about what they could do to fix the ACA, to move forward, to fix any problems with it. I think it was Senator McCaskill, perhaps, it was a Democrat who filed the bill this week that said we should open up. If there is a county anywhere in America where the insurance exchanges don't offer a plan to an American citizen in the exchange, then they should be allowed to buy the same health care, buy into the same plans that our members of Congress get. I hope Republicans will join with Democrats in that solution. I think that's what we need to do.
But it needs a lot more than that. I mean, the bill needs a lot more than that, and the whole effort needs a lot more than that. I mean, is compromise, really tenable and possible?
Well, I don't think there's a choice. I think the question is what you're compromising on, right? Democrats want to go back and look at the ACA, all the good it's done. The fact that right now, since records have been kept, we have the lowest number of Americans left uninsured in this country in the history of our nation. More people today have access to life-saving health care than ever before. We should look to continue that trend and how to fix the problems with it, not scrap it and start over with a program that at the outset will discontinue 20 million Americans from getting the health care access that they would have otherwise.
Those are some of the positive aspects, but what about the premiums that have gone up? People have had to pay so much more, and others who have lost their care.
That's the problem here, Eric, and it comes down again to costs that are out of control. And I kind of like the compromise, you might call it a compromise, if we don't get to 50 votes in the Senate, that Nebraska Senator Ben Sasse came up with, which is repeal now and take the remaining year ahead to get it right. Because what Americans want, they don't want to fix Obamacare, and frankly, if it's broken, they don't want to fix TrumpCare. They want to fix health care. They want to get this right. And in terms of, I disagree with the comments before that Democrats have not been to the table, but they need to be, because we need an American solution, not a partisan one, an American one. And I actually think if for some reason we don't get to 50 votes in the Senate, that becomes more probable, if not more likely.
Well, Rand Paul has been another no vote. As you just hold that thought for a second, let me show you what Rand Paul said about that and get your reaction.
The one thing we should do is try to repeal as many of the taxes, as many of the regulations, and as many of the mandates as we possibly can. I still think the entire 52 of us could get together on a more narrow, clean repeal, and I think it still can be done.
So, Isaac, you think that's possible, that they can actually work something out with this time?
a straight repeal would leave so many Americans without access to health care, and it would put the burden of Medicaid entirely on the financial burden entirely on the states. And I think that's part of the problem that Adam and some of the folks looking at this vote are not taking into consideration, right? Some of the votes that they're so critical and important for Republicans right now from Nevada, from Ohio, from West Virginia. If you do away, and this is according to the Joint Economic Committee from the U.S. Senate, if you do away with the ACA and pass the BRCA, that means that you don't even have this gap in those states to make up the funding shortfall so that people aren't left to die out in the cold without health care. Would cost anywhere from 25 to 50% of secondary and elementary education.
We're out of time, but what about that, Adam? Last word.
All I can tell you is the only way to fix all of this, Eric, is with everyone coming to the table, providers, patients, pharmaceuticals, everybody. It's the only way we're going to get a system we can sustain and that will protect the health of the American people.
All right, Adam and Isaac, they have another week to work on it. They're at apparently 50 votes right now. We'll see if some Democrats come along and can work something out. Thank you both.